When should you worry about eye floaters? Have you ever noticed tiny cobwebs, squiggly lines, or specks drifting across your vision, especially against a bright sky or white wall? These are called eye floaters. They're common and usually harmless, especially as we age, but sometimes they can signal something more serious. So how do you know when to relax and when to pick up the phone and call your eye doctor? What are eye floaters? Floaters are small shapes that appear in your field of vision. They happen when the gel-like substance inside your eye, called the vitreous, starts to change with age. Little clumps cast shadows on your retina, creating those annoying squiggles you see floating around. For most people over 50, floaters are simply a part of getting older. But changes in floaters, or floaters that show up with other symptoms, deserve attention. Causes of eye floaters. Floaters can come from several different conditions. Bleeding in the eye. Sometimes blood vessels rupture due to trauma, stress, or underlying eye problems. This can create specks or haze in your vision. Smaller bleeds may clear up over time, but larger ones might require surgery. Eye infections, certain viruses and bacteria, such as herpes viruses, Lyme disease, or tuberculosis, can inflame the retina. Along with floaters, you may notice redness, pain, fever, or chills. These require medical treatment. Eye injuries, a blow to the eye, chemical exposure, or an accident during work or sports can cause floaters, pain, or even vision loss. Mild injuries may heal with rest, but serious ones demand emergency care. Retinal detachment, this is the big red flag. If the retina pulls away from the back of the eye, you may notice sudden floaters, flashes of light, or a dark curtain across your vision. Retinal detachment is a medical emergency that can cause permanent blindness if untreated. Uveitis, inflammation of the eye's middle layer, can cause floaters, pain, blurry vision, and sensitivity to light. Steroid medications are often used to control it. Vitreous detachment. Very common after 50, this happens when the vitreous gel pulls away from the retina. Most of the time it's harmless, but in about 15% of cases, it can lead to a retinal tear, so sudden changes should always be checked. Treatment options. Most floaters don't need treatment. Your doctor may simply monitor them during routine eye exams. But in rare cases, severe floaters or floaters tied to other eye problems may require intervention. Vitrectomy, a surgery that removes the vitreous and replaces it with a clear fluid. It doesn't always remove every floater, but it can help in severe cases. Laser vitreolysis, a laser procedure that breaks up floaters so they're less noticeable. While sometimes effective, it's still considered somewhat experimental. The bottom line. If you're over 50, floaters are a normal part of life. Most of the time, they're harmless. But if you suddenly notice more floaters, flashes of light, or any vision loss, don't wait. Call your eye doctor right away. Your vision is too valuable to take chances with. Pay attention to the signs, schedule regular eye exams, and if something suddenly changes, trust your instincts and get it checked.